Hello friends, welcome back to my channel. My name is Dr. Jamie Canada. I am a physical therapist who specializes in pelvic floor physical therapy, and I am so excited to be back with you. If you don't recognize me, got a little dolled up for you all today, so you're welcome. Just kidding, but today I want to talk about a very important subject, especially in the realm of pelvic PT, and that is what to expect in your first appointment and what is the internal pelvic floor PT assessment, and is it something I have to do? So with your first appointment at pelvic floor PT, it's going to start off very similar to if you've ever had any other PT visits, whether that's like general orthopedics or just any healthcare visit in general, where we're going to sit down with you in a private room and really get to know, first off, what brings you in, why are you seeking out pelvic PT, how much do you know about pelvic PT and how it can help, and then really getting down to, your past medical history, any symptoms you're having, your goals for therapy, all of that. So that's really the first priority of the appointment and that first day. Depending on, what is gathered from that initial information or subjective information, your PT will then go into more objective findings. So this might, jump into more of an orthopedic base where we're checking mobility, your strength, your flexibility, and just overall how you're moving. So it's going to vary, based on what you're coming in for and what your PT wants to prioritize that day. But then you will have the option to do an pelvic floor exam. And I know that can sound really scary to people, especially when we offer like the internal portion. And I think it's really important to educate during this time. During my last clinical, can say that I've had many patients look at me after I'm like, all right, like, how do you feel about internal assessment? And they're like, what do you mean? So I feel like today it would be good to focus on like what that entails, and just knowing that it can be very helpful, but it's never something that is obligatory. You never have to say yes to anything ever. So after we've gotten more information objectively based on like how you're moving, general strength, as I mentioned, then we'll go into the education on what we can do looking directly at the muscles. So first thing I like to do with patients is just go over what the pelvic floor is before I go into like detail of the exam itself. So I like to describe the pelvic floor as the muscles that you see in red that span from pubic bone in the front to sacrum tailbone in the back. So that just kind of gives you an idea of where are these muscles located. After that, just generally giving an idea of knowing like where these muscles are. I like to go into like their function. So the muscles that you see more externally here are going to be involved in sexual function as well as helping with continence. So being able to contract to hold urine, feces in, and relax to allow them out. A lot of the time, tightness in this area can lead to pain with sex, especially if you just have it, especially with insertion. The second layer of muscles you're not able to see on this model, but they further kind of wrap around the urethra and the sphincters to help with continence. And then the muscles that are your third layer or deeper pelvic floor muscles is a group called the levator ani muscles. So those are going to be what you see here, and they act almost as a bowl to help support your organs. So if someone comes to me and they're like, hey, I have this feeling of like heaviness or like something's falling out, could potentially be due to like weakness, laxity, and then that would definitely warrant my offer for an exam. After I've kind of explained a little bit of the anatomy, the function, and why. So, hey, like based on your symptoms with pain with sex, I'd be interested to see what's going on directly at the muscles. So first, the external exam would be just me looking to see if you're able to contract, relax the pelvic floor muscles, how your coordination is. And then if it's okay with you, I would start externally palpating those muscles with a gloved finger or two, just to see what those muscles, if they're feeling tight, if there's differences side to side, any tender points. And then from there, if you feel comfortable, the best information with strength and quality of movement is going to be determined with an internal assessment. So an internal assessment is by no means mandatory, but it does help give really good information, and internal exam can warrant me to do muscle release internally if that's something that you consent to. Just to pause for a second, no pelvic PT is ever going to force you into this. We want to make sure you 100% feel comfortable, and know that this exam, we don't use any kind of tools, so no speculums. The table does not have stirrups, anything. You're just laying in a comfortable position, and then one lubricated gloved finger is inserted for the exam. So getting into what the internal exam, like what to expect. Typically, I'd set up my table with sheets. I'd step out, have you disrobe from waist down, cover yourself up before I knock to come back in. From there, I want you to be in the most comfortable position. So maybe that's on your back with your knees bent, your knees out, one leg up, one leg down. We'll work together to make it as comfortable as possible. And then, as I mentioned, we would work superficial to deep. So those more shallow layers, if you will, and then working layer by layer to check for function. So if you say, yes, I want to go ahead with it, I'm always going to continue to check in, as well as if you go to your appointment and you can always decide no after. We're not going to push you or force you into anything. So let's say we start with the internal, you're like, hey, I don't feel comfortable, we'll stop. And this is something that if you don't want to do the first day, and you want to do it eventually, it can be in other, like, further out sessions as well. So with that one finger glove lubricated, we'd start at the introitus, the vaginal opening. First, kind of looking at what's the perineal body doing. So is there tightness around the opening, pushing down, but then also out and up? And then I would have you, hey, can you contract around my finger? Can you relax? And then working more to the second layer if you feel comfortable with that. For the second layer, I may actually look a little more toward urethra to see if there is any restriction or hypermobility. So that would be more of a finger turned up. And then that deeper layer, which would be just about to the third knuckle, I would have you contract, relax, and then checking side to side once again for any tightness, tenderness, anything that could be giving me information to best set up your treatment plan. I will say I've had great success with patients both with and without the exam portion, but I definitely think it's helpful if it's something that is warranted and you're open to, but just know you're always going to be the boss of the sessions. I can't speak. So just know that. I did forget to mention with looking externally, I also would have you do like contract, relax, cough, seeing how are you managing pressure. And then after that, I would let you know, hey, this is what I found. For example, hey, I noticed that you're unable to really give me a lift of that pelvic floor squeeze. So I think some of the issues you're having is from some weakness. So here's what we can do moving forward. Something else, I might say, hey, I noticed that when I tell you to do a Kegel or contract, you're really using your bottom muscles, your hip musculature to do all the work. So we might work on kind of quieting those muscles and finding how can we improve the isolation of pelvic floor. So lots of things that we might find and then apply to treatment going forward. After the external and or internal portion, then I'd wash my hands, let you get dressed, have you open the door when you're all set, and we'll sit down and kind of talk about plans going forward. I definitely like to give homework for your sessions. So depending on where you are, so I'm going to be starting in a clinic that's one-on-one with PT for an hour. So from that, based on the history, examination, whatever time we have left, I would like to kind of work on treatment. So from there, we would do that, and then I'd give you things to work on for home. So then the next time you come in, we can jump right into things and continue to progress you at home. All of that to say is there is nothing to worry about when you come in for your first session. I hope this gives you like peace of mind that, all right, the internal exam is not mandatory, but it's also not scary. I definitely understand too, like people that come in with pain, that can be, you might think, well, it's gonna hurt to do that. Our goal is never to hurt you. It's just to sometimes almost replicate your symptoms so we know exactly what is going on or what could be causing it. But your pelvic PT is going to make your experience individualized to your needs, your comfort level. So just know going in a good clinic and clinician is always going to do what you feel comfortable with. And if you don't feel comfortable, be sure to speak up. Maybe it's just not a good fit. There's going to be someone out there that will be very helpful for you. So I really hope that this ease your mind about that first initial assessment and the potential of an internal exam. If it makes you feel any better, pelvic PTs have all gone through training where we have to do this on each other in lab. So we know what it's like. We know that it can be nerve-wracking, but also that it can be so beneficial and help you improve your quality of life. So thank you so much for watching. I hope this was informative and relaxed your nerves a little bit. Please, if you enjoyed this, give it a thumbs up, subscribe to Loom Pelvic Floor PT, and I can't wait to see you at the next video. Bye.